Hello out there in television land. Welcome to yet another edition of It's Your Health. I'm with my bride, soulmate, confidant, best friend. I'm running out of adjectives. I guess I want something later on. But moving right along, what we're going to do is talk our first segment a little bit more COVID related, and in the second segment we're going to work a little bit more on dementia illness. And like Jeopardy, our third segment will be kind of a potpourri, if you will. Is that all right with you?
Yes, as long as you tell people to check with their doctor.
That's right. Check with your doctor before doing any of the things that we talk about here on It's Your Health. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back after this brief commercial message. Welcome to the first segment of It's Your Health. But let me remind you, when we mention commercial messages, we've been doing this for what now, 25 years. And you would do us the best service ever if you would patronize, call the people who help sponsor and make It's Your Health possible.
That's a good point.
Very good point. Mm-hmm. Do you want to start us off?
Well, this section, as you mentioned, is all about COVID, although the first headline doesn't sound too much like COVID. The question is, and I have this question too, why does my arm hurt after I get a shot?
Well, you're getting a foreign body injected into muscle, and they're putting liquid in there which expands the muscle, and it could have some anti-inflammatory effects as well. So it's kind of like a shot in the arm, if you will. An old trick that worked for me when I got vaccinated is I put my arm behind my back. And one of the interesting things that happens is I cannot tense up that muscle that gets injected when I put my arm behind my back. Otherwise, the shot goes in there and you involuntarily tense the muscle, which in theory can cause some more micro damage. But not a big deal. And if you do get inflammation, you can sometimes get relief by putting a cold compress on it and just sit tight.
Get it in your dominant arm, and as he mentioned, he was right, relax your arm. Don't do any strenuous exercises. You can use over-the-counter medications and then a cool compress.
You know what? I'm glad it's taped because you said I was right. I never heard that before in, what, 40 years of marriage?
It's not 40.
Oh, why does it seem that way?
It seems like 50.
Okay.
Next one. How can I tell if I have a concussion?
Usually you would think of concussions, you would lose consciousness, but not always. A concussion can happen when you get a severe blow to the brain. And what happens is your brain actually moves in some fluid and jiggles around and hits parts of your scalp and can cause some issues in terms of symptoms: headache, nausea, vomiting, lightheadedness, dizziness, changes with vision, particularly in bright lights. And concussions are serious because, as I said, the brain moved around and may have sustained some micro damage. So that's why you don't want to go back in and do it again.
Imbalance, impaired depth perception, difficulty remembering things, or changes in your sleep pattern. All of those are reasons that you need to contact your doctor. Yeah. Better safe than sorry.
Absolutely.
Statin therapy, vastly superior to common dietary supplements for cholesterol lowering.
We see this all the time. The cholesterol's up and we say, listen, it's probably something that you inherited from your folks, and diet and weight loss may help, but may not bring you down to goal. And so we often say, why don't you try a statin? And people, of course, don't want to take a medication and want a nutritional supplement. It turns out they really don't work as well as we would like them to. So really, if you're interested in bringing your cholesterol down, lowering your stroke and heart attack risk, reducing plaque formation, you really should consider a statin.
They studied 6 over-the-counter supplements for this, and none of them worked any better than nothing.
Oh.
So they're not helpful.
As we say in the business, placebo.
Well, I saw placebo there, but I said nothing. I thought it was more of a point. Anything else I'm doing wrong?
We only have half an hour. So go right ahead.
Okay, how to share time, not germs, at gatherings. There's lots of holiday gatherings all year long, birthdays and anniversaries.
Oh, you know, it's typical in our line of work. Monday or Tuesday we get calls because people were away at super spreaders. Sometimes, unfortunately, funerals where people are unmasked and crying and hugging, weddings, get-togethers. It goes on and on and on. And I'm sorry, we still need to consider wearing a mask. In my car, I have a hand sensitizer. As soon as I come out of something, I do my hands. And so you really have
It's
to have...
It's a sanitizer.
Isn't that what I said?
No.
Okay, so in either event, I always do things wrong.
Oh, well.
So the point is you have to have your guard up. You cannot let it down.
And a lot of suggestions, open windows if it's not this cold, put up fans, gather outside if it's nice out, get vaccinated, check what it's like in your community. You can check that on your CDC website. Skip the event altogether. Wear a mask, wipe down surfaces, and limit who serves. Who's ever serving should be wearing gloves.
Yeah, that's true. I didn't think of that.
So there's a lot of things you can do to keep yourself safe. This is an interesting one. COVID-19 may trigger irritable bowel syndrome.
Well, again, we're still writing the book on COVID-19, and there is this COVID long hauler issue that can affect the bowels. We've seen irritable bowel syndrome, ulcerative colitis. Some people are just not quite right after this illness. And unfortunately, we're not sure exactly what to do about it except to exclude other conditions that we don't want to necessarily blame on COVID-19.
Okay, do you know the gastrointestinal symptoms? They're like heartburn, constipation, diarrhea, abdominal pain.
That about covers them all.
Yep. You need to get adequate sleep and some exercise.
And one more thing about this COVID-19 that we've seen that we're going to get into a little bit later in the next segment is a dementing illness. And some people actually have reported to us that after the shot, they've kind of come down a notch and have symptoms that they're blaming on the shot, such as focusing or cognitive issues, shortness of breath, feeling tired and weak. But they did find out that once you have the COVID-19, it can affect the brain as well and induce almost a picture that's identical to a dementing illness.
Oh my goodness.
So that's one of the things to look out for. And speaking of looking out, we're almost out of time here for our first segment. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader.
Where?
In healthcare information.
Oh.
Another fault of mine. Welcome back to the second segment of It's Your Health. I'm with my bride, as usual, and we're going to talk about the dementing illness, which is affecting, unfortunately, a great deal of our elderly. As a matter of fact, as time goes on, we're diagnosing more and more cases, and as the baby boomers are aging, some of them are not aging gracefully. And it's said that by the year 2050, 1/3 of you out there in television land who are over 65 may have to deal with a dementing illness. So let's start it out.
Well, let's talk about what Alzheimer's disease is. It's a progressive, degenerative disease that attacks the brain and results in impaired memory, thinking, and behavior. It's a gradual onset and continued cognitive decline. That sounds awful.
Well, Alzheimer's is one of the bigger under the umbrella of dementing illnesses. Keep in mind there are other forms of dementing illnesses. There's vascular ones that we see with many strokes. There's ones that boxers get because of brain damage. There's ones that people get if they have Parkinson's disease. There's some that come from alcoholism. But we're going to talk about the biggest category, and that is the Alzheimer's type of patient. And one of the most important things that I think is to realize is that when you come into the doctor and you say, I have a memory problem, I forget a person's name, I'm worried I have a dementing illness. Believe it or not, that's very, very late in the course of this illness. About 30 months before you come down with Alzheimer's, it shows many psychiatric issues first, like social withdrawal, agitation, depression, paranoia, not wanting to leave the house. These are markers that are going to tip us off that this person needs to be watched, that could go on to a dementing illness. So the memory one, I think people kind of key in on. But the other issues where you see a change in personality, social behavior, withdrawal, agitation, paranoia, inappropriateness, these are the tip-offs that this is where we might be heading down that road.
Okay. Would you like another headline?
Please.
Okay. I like this one. This one was really interesting. TV watching, but not computer use, may up dementia risk. Watching TV may increase your risk of dementia, while using a computer may lower it. When we're doing cognitive activity involving the computer, we're using large parts of our cortex, our brain, to carry out that activity. We don't do that when we're watching television.
You don't use it, you lose it. And so watching television, of course, is very passive, and doing a computer is kind of like doing brain exercises. So absolutely.
Tell us how hearing affects your brain health.
A very interesting study that showed that people who are hearing impaired can have brain issues resembling Alzheimer's, or could actually go on to Alzheimer's. Say, well, what does that have to do with things? Again, if you are not hearing things, you're not stimulating your brain. But more importantly, people who are hearing impaired often avoid social situations, which we mentioned earlier. That social isolation and wanting to be withdrawn from being around people is again a tip-off and a concern that the hearing impaired people can go on to dementing illnesses because they do not want to be around other people because of their hearing impairment.
Wow. Well, they do recommend that you get your hearing checked every 2 to 3 years.
And it's something that we see quite a bit because some of our baby boomers went to rock concerts or are operating chainsaws or lawnmowers. You really need to protect your hearing, because once you've damaged those ear cells and nerve cells, they're not coming back.
Well, so sometimes you just need your ears cleaned.
That's true. That is absolutely true.
I have a picture here for you.
This is interesting. I think it'll explain to you out there how a normal brain looks and functions, and how an abnormal brain, an Alzheimer's brain, looks. Look how shrunken it is, how the valleys are bigger, if you will.
It's a different color.
It's a different color. And one of the things that happens that we feel in Alzheimer's is, and you're going to see on this other slide, that the nerve cells are nice and crisp, and you can actually see one nerve connecting to another. You get a buildup of this stuff called amyloid. It's kind of like a protein. We're not sure what causes it. Could be induced by many things, some of which are hereditary. But you can see how it clogs up these nice fibers and nerve cells that are supposed to communicate with each other. It's like wrapping duct tape around some of these things so they don't communicate. But let's go through some of the things, maybe not all of them, about a normal brain. Again, I said earlier, sometimes if you can't recall a word Or if you forget someone's name, people are worried, does this represent Alzheimer's? But it doesn't, because the Alzheimer's patient's what?
Unable to think
Right.
Normally.
Exactly. Someone might be slower to do things or might be slower to think, and of course that's can be considered normal aging process.
And somebody may not be able to do it at all, and that's not normal.
If I am studying something and I just can't recall the factors of it, and the new data, if you will, doesn't sink in, that's something that as we age, we kind of learn at a slower rate, but it's not dementia.
But if your personality or your behaviors change, that is.
Right, exactly. And often the thing that I use is I say to patients, I may forget where I put my cell phone. That's kind of normal. What isn't normal is if I look at this and say, well, what is this thing for? Okay, you kind of get the drift, right?
I get the drift.
Okay. Moving right along.
Well, this one you're going to have to answer it because it's called the Pearl of the Month. How can I keep from losing my mind?
Well, they did several things and studied all these patients, and everyone out there wants to know, well, how do I maintain my brain health? And we talked about it earlier, using crossword puzzles, keeping social ties, that's very, very important, and exercise, regular diet, get rid of smoking, and limit alcohol use. But of all the things that they found out, taking a multivitamin over the counter, A to Z, whatever, Centrum, Silver, is probably one of your best things to do to stave off a dementing illness and maintain brain health.
Walk more than 4,000 steps a day, and make sure your vision and hearing are in good condition.
Exactly.
Wow. Okay. COVID-19 is linked to increased Alzheimer's risk. It significantly increased the risk for new onset Alzheimer's disease. The risk was especially high for women older than 85 years.
And we've seen this time and time again, especially in the nursing home setting where the people are a little cognitively impaired to begin with. They came down with COVID, and guess what? They really went down a notch or two and unfortunately are not coming back. So it's
very sad.
Very devastating.
And it's very sad when you know somebody who has it and see what they're going through and what their caregivers are going through.
We're going to talk about that just in the next segment. We'll touch on it briefly about caregiver stress and how difficult it is to deal with someone who has this illness. But as time marches on, we are at our closing segment of It's Your Health. We'll be back right after this brief commercial message. And again, patronize our sponsors, or at least call them and tell them you heard it on It's Your Health, the leader in healthcare information.
Very good.
Thank you for once. Welcome back to the third segment. I'm with my cheerleader, best friend. What else? I ran out of adjectives to describe her.
That didn't take much.
Listen, we did talk about caregiver stress, dealing with a patient with a dementing illness. And it sounds cruel to say, but the person with the dementing illness will bury the caregiver because it's overwhelming to take care of someone at home 24/7. It truly is. It requires a great deal of help. And so you may need to think through trying to care for someone at home as much as you'd like to. But that being said, we're going to go on to headlines.
Okay, and short walks after meals will cut your diabetes risk. Light walking after a meal, even for 2 to 5 minutes, can reduce blood sugar and insulin levels. Typically, go 60 to 90 minutes after you eat and go for a walk.
Yeah, that is impressive. And, you know, most people end up having a meal, they sit down and fall asleep.
Watch
So,
TV.
That's watch TV, you're right.
Oh, and here's another one. Sugary drinks linked to obesity-related cancer deaths. Drinking 2 or more sugar-sweetened beverages daily may raise the risk of dying from obesity-related cancers. Consuming these artificially related beverages was linked to an increased risk of death from pancreatic cancer.
Wow.
And that is like one of the worst.
Yeah, that's, well,
They're all bad.
they're all bad, but pancreatic cancer is particularly sneaky because by the time you diagnose it, the horse is out of the barn, if you will.
Yep.
But yeah, when you realize that there's probably, what, 8 teaspoons of sugar in a can of soda, I mean, who would possibly ingest 8 teaspoons of sugar at once? But apparently this fructose and the other stuff that's in sugary drinks are to be avoided.
Well, then, would diet drinks be okay?
Well, that's another,
There's a lot wrong with those.
absolutely, we're not necessarily advocating that. What's wrong with just maybe some water?
Let's go to the next headline.
Okay.
I tell you this all the time. Why people should avoid wearing shoes in the house.
All right.
If you wear shoes for more than a month, 93% will have fecal bacteria on the bottom of their shoes, which includes pet waste, the floor of public restrooms. It carries mold, pollen, other allergies. Take off your shoes.
You'd rather smell my feet than...
Well, that's a tough decision, but yes.
All right. I think what we need to do is to have my slippers. Maybe you need to bring my slippers to me.
I don't think so. I think you can put your slippers right by the door.
Okay. I will start.
Bring him his slippers. Train the dog to do that.
All righty.
Okay. Well, we're going to talk about something a little bit different, spiritual assessment. Understanding a patient's spirituality impacts the relationship with the doctor, as well as making decisions, particularly those related to end-of-life decisions.
Yeah, it's something you don't really think of or hear about or see in an office setting because they're sterile and clinical, and some people are not necessarily open to it. I find that when I talk to some patients, we talk about the old times when we grew up in a charmed environment. We had neighbors, we had respect, we had faith, we had our evening meals, we had church services. And a lot of that has gone by the wayside. But believe it or not, people still retain that burning coal of wanting to seek a higher power. And if patients are receptive, and they often are, introducing a spiritual concept into the office visit is absolutely very, it goes both ways. We both feel good about it.
Well, it has a positive impact on the patient's spiritual well-being and may impact other outcomes such as meaning, purpose, the will to live, acceptance of death, and emotional well-being.
Yeah,
so it can affect all of that.
We have surrendered, I think, a higher power to this thing, and so I'm not so sure it was a good trade.
A lot of people are saying that. This is one that people are discussing. Does daylight saving time changes disrupt your health?
Well, it disrupts mine. So, you know, and our bodies, for however thousands of years men and women have walked the planet, we work on a 24 circadian rhythm, which might be changed a little bit by the seasons, but to actually have these clock changes and, you know, come home at night when it's dark after work, and it adds to the angst of a depressive time of the year fall and winter when it's darker earlier, it's a little cooler. And so I think they're going to eventually do away with it.
Well, it affects a person's ability to concentrate or to pay attention. The rate of motor vehicle accidents increases when the clocks change.
Yeah, well, that kind of makes sense.
Wow.
Wow is right. Speaking of driving, I have just noticed that it has become more aggressive and more difficult. People will pass you and turn in, and they get no further ahead than the next red light when I catch up with them.
I know. You have to be really, really careful because people just will go in and out and
Yeah.
terrible.
Yes, it is.
Here's one for me.
Oh, good.
What can I do to prevent gray hair?
Well, you have to pick good parents, for one thing. It is a hereditary event. And you really don't get gray hair. Actually, what happens is you lose the pigment that your body would naturally have made, which could be altered, for example, by your habits. If you're someone who's not getting your adequate fruits and vegetables, which I doubt since I cook for you. You don't smoke. Smoking can lead to gray hair. And, you know, women sometimes do a lot of crazy things like perms and harsh treatments, which, of course, I'm not so sure the hair likes.
Well, believe it or not, starting around age 35, you will start to get gray hair. Your hair lives for 1 to 3 years, then it falls out, and then in its place, you could get the gray instead. It goes up 10 to 20% every single decade. And Caucasians tend to go gray earlier, but redheads the most.
Oh, really? Mm-hmm. Well, I kind of like the salt and pepper, quite honestly. So why not?
Well, after all that they've said about the different dyes and that they're dangerous.
Yeah, well, I kind of would like to stay as natural as we can, right?
Okay.
All right.
Let's naturally close this up.
Okay, do you want to take us home?
No.
Okay. Well, thank you again for allowing us to inform you and hopefully entertain you this past fastest half hour in television history. Join us again on the next adventure of It's Your Health, your leader in healthcare information. And thank you to our sponsors and particularly Samsung Productions.
And Sammy.
And Sammy.